Welcome back. Now, I hope you're not about to have your supper because this is going to make you wince. People in the UK have been forced to pull out their own teeth at home because they can't access or indeed afford an NHS dentist. A report by the Health Select Committee found that DIY extractions, you could say that again, have been performed with pliers in some cases, while others have been forced to make a 5-hour round trip to see a professional. The committee recommends updating current contracts with dentists and launching a public information campaign to explain how NHS dentistry works. Well, I'm joined now by Grant Lakey. Now, he couldn't get to see a dentist, so he pulled out his own teeth using shoelaces before then travelling to Turkey for treatment. And we're joined as well by Onur Ake, who is from the dental practice where Grant was then seen, though he didn't actually treat Grant himself. Welcome to both of you. Grant, I've got to come to you first, my friend. I mean, how bad could your teeth have been that you had to resort to using shoelaces to pull them out?
Well, I lost a tooth and basically the other teeth started moving and I couldn't get a dentist. So basically what I'd done was I had to resort to putting a shoelace around my teeth that had moved and garroted them, and they came out that way, which was very painful and obviously had infections afterwards, so it wasn't good or clever, really.
No, I could have told you that for nothing. Probably using shoelaces not the best thing to do. So what made you then go to Turkey?
Well, I've done a lot of research and Turkey was the best option. And then I went to other sites with dentists in Turkey and I found that Dentacay was the best one and the one that got the best reviews. So it was a no-brainer, really.
And let's bring you in here, if we may, talking to us from Turkey. I understand you're setting up a practice here in London because the demand has been so great, getting people coming over. What are you doing differently? Why are people coming to Turkey?
Good evening. Yes, the demand is rising up because when we opened our first hospital in Istanbul 3 years ago, we just treat a few patients from UK in a year. Last year, we have treated more than 2,500 patients from UK, which is 50% of our total patients number. So this demand shows us rising up. So we are going to open by the way, we are going to open a new dental consultation center in London next week. Why they are coming to Turkey? Because there are so many advantages in Turkey. Affordable prices if you compare with UK, high quality, and also NHS long waiting list for the treatments.
I'm just looking at some of the cost differences, and the UK will charge you £1,800 for a root canal treatment, whereas in Turkey, the average cost looks to be about £130. Now, I might be a bit suspicious about that. Sometimes you get what you pay for, and just wondering, is the quality the same? Are you adhering to the same guidelines in terms of hygiene, in terms of insurance?
Yes, we can say that the quality is more better than the Europe and USA and the UK, of course. The procedure and the hygiene is the same. We are following the same rules in our worldwide rules. Why we have this cost advantage? Because we have our labor cost, staff cost is more cheaper. Materials and the dental implants are more cheaper. And also we can say that the exchange rate advantage, we have exchange rate advantage, honestly speaking. So this makes us more affordable.
And Grant, let's bring you back in here, because you went off to Turkey. You wouldn't have known how much it was going to cost you, I guess, because you didn't know the extent of the work that you needed. How much did it cost, and was it a surprise?
It cost me a lot less than what I was quoted in England, that's for starters. And the actual cost it cost me out there was, I think, £6,000, which was brilliant. You know, over here it would cost, I think I was quoted £30-something thousand for the same treatment. And when I was over there, the treatment was done very efficiently, very well. They treated me well, so special out there. It was brilliant, and the quality has been fantastic. I can't fault them at all. They were brilliant.
And can I come back to you, if I may? We're hearing horror stories sometimes about people coming back with what are called turkey teeth, where their teeth have been drilled down to stumps, that there's no follow-up, and then they end up with expensive correctional treatment back in the UK. How do people know what they're getting and if it's going to be good?
Yes, we have some sad stories. They're coming to Turkey because of they couldn't reach the treatment in UK, so they are using alcohol to kill the pain in his teeth. And also, we have a bad story about one of our patients had a car accident and he couldn't get the treatment in UK, and he waited for 9 months for the treatment, but he couldn't. Then he came to Turkey for the treatment.
Ona Ake and Grant Leakey, thank you very much indeed for sharing your experiences with us here on Sky News.